Welcome to Talking Women's Health. I'm Amy Young. I'm the CEO of ABOG. And this is a podcast where we have the opportunity to interview amazing leaders in the field of obstetrics and gynecology. And today is no different. I'm here to introduce my guest. This is Dr. Alan Ghareeb. He is a second year, soon to be third year, MFM fellow at the University of Washington. He is going to pursue a career in critical care. I called him an interventionalist obstetrician yesterday. He is the immediate past National Junior Fellow Chair for the American College of Obstetricians and Gynecologists. And so not only has he established himself as a leader in the field as a junior fellow, but I expect great things out of you in the future. So welcome so much today, Alan.
Thank you, Dr. Young. It's my pleasure to be here today.
So we're going to talk about a couple of things specifically today. So really outreach and also clarity in our specialty. Do you mind if we go ahead and get started?
Let's do it.
All right. So what I wanted to start out with was just talking to you about outreach and specifically residents, fellows, and people early in practice. I think ACOG calls them junior fellows. And in our case, we think about them as candidates to take the assessments so that they can become diplomates of ABOG. And so one of the things that's really different about the board right now that both myself and my executive leadership staff and the staff here at ABOG and our board thinks about is how do we really promote safe care for women? And so we've really developed three themes that we've sort of couched our strategic plan in and everything that we do. And those are the promotion of mastery from residency to retirement, connectivity, which we think really has to start with the group of people that you really represent today, so residents and fellows that are still in training. And then we also think that the board has a really important role in being a calm, influential voice for our specialty, helping guide and steer, the next generation of safe providers for our specialty. And it's kind of a unique lens that we do that through certification. But I wanted to talk specifically about this role of connection first. Dr. Ghareeb, we've gotten to know each other fairly well over the last few months, and I feel like my working with you has just really enriched my life. And I think you can provide just an enormous insight on how better to connect with the junior fellows, the residents, the fellows, and the young providers in training. What do you think some of the ways that ABOG could do a better job of that are?
The junior fellows are probably some of the most passionate group of people I've ever had the chance of working with. And serving as their chair for the past few years has been one of the greatest honors of my life because I've gotten to see this group of young physicians, residents, fellows really develop into advocates for each other and for their patients. And I think one common theme is that we love to share our stories and we want our stories to be heard because I think we're all really dedicated to making the specialty better for the next generation of trainees, for board certified physicians, and for the next generation of advocates. And I think one thing that ABOG did really well was meeting the junior fellows where they are, both physically and as well as ideologically. Coming to the ACSM or the annual clinical and scientific meeting was really wonderful because it gave the junior fellows an opportunity to hear from you directly, to get to share their stories with you right away. But it also gave them a chance to get to see kind of what's going on behind the scenes. I think historically, ABOG has been this really elusive organization that it's this hurdle you have to get over to become a board certified physician. But when we talk about things like connection, I think one of the biggest things we can do is build a community. And I think we're at a time in the specialty where it's so important to have a unified identity as an OB-GYN, as a master of the specialty. And so I think any opportunity we have for ABOG and the junior fellows and this next generation of trainees and physicians to connect should be pursued.
So let's talk specifically about some of that connectivity. And I did want to share with you, I think you know this, but I still work clinically. I thought I wanted to work clinically because I didn't want to leave clinical medicine, but actually I love teaching residents more than life itself pretty much. And so I kind of really worked hard to make sure that I could maintain that sort of relationship in that part of my career. It grounds me. It makes me do, I think, a much better job here, and I think I probably am doing a better job there too. But let's just talk pragmatically about connection. I mean, you guys are connected to absolutely everything. What are some of those real tangible things that ABOG could do to connect sooner with residents and fellows?
One idea I've had is I think, one of right after board certification or right after you become a diplomate, like that's such a great opportunity to build community, whether it's through some sort of celebration. You know, one of the hallmarks of being an ACOG fellow is becoming board certified and getting to go through kind of the pomp and circumstance that happens at the annual clinical and scientific meeting. But I think it would be a really great opportunity for ABOG to be more involved in that discussion and also in that celebration. And I think when we talk about maintaining that mastery or maintaining that community, all of us end up doing very different things. Our clinical practices look very different. We span such a wide range of geopolitical environments. And I think one thing that would be really wonderful is for there to be an avenue for the diplomates to connect with each other, whether it's to discuss the articles, for example, or to see how those articles can be placed into their practice, or what is the next step besides just having these new diplomates kind of read these articles, take the quizzes, but how can they apply it with each other and within their practices? Or is there some sort of forum where they can connect with each other or communicate? Or, you know, practicing in Texas looks very different than practicing in Washington, and what can we learn from each other through kind of a formalized avenue?
You know, professional identity is something that's really important. I think community plays a instrumental role in that professional identity. You know, having that opportunity to be supported and to support others. You know, medicine is not an easy place right now, and OB-GYN specifically isn't an easy place. And I don't think that is necessarily different no matter what state you live in. I think some things may be harder for others in some states and vice versa, right? So establishing community is important. Let's talk a little bit about the institutions. You know, one of the things that I think has taken me years to understand, and I used to do something for the ACOG district. I called it the Ogs and Goes of OB-GYN to try to explain the different entities. I think there's different entities that are really responsible for us in OB-GYN from residency to retirement. You have professional societies like the American College of OB-GYN. You have the board, the American Board of OB-GYN. And then you have the ACGME and the review committee that really takes care of residency programs. We each have very different roles. We kind of have different lanes that we work in, but together we collaborate and do, I think, great things to move the specialty forward. I think a lot of times, you know, I saw there was a need to try to explain this, at least on a district level. I mean, do you think most residents and fellows and young people in practice understand those differences? And what are some of the things we could do to make that a little clearer to everyone?
I mean, it's such a great question because admittedly, I think up until I had my position within ACOG, I really did not see them as such distinct entities. But the more I've had the opportunity to get to know individuals within each organization, the more I've really been able to appreciate what each organization's mission is. And while they are really distinct, I do think they actually share a very common goal, and that is for us to show up the best that we can for our patients. I don't think most trainees actually recognize the distinction between these organizations. And, you know, from a trainee perspective, you're only worried about getting through residency and meeting those requirements. And so ACGME, as the title might suggest, is focused on accrediting your training. And that to me means being able to graduate ready to serve the best that you can for your patients. ACOG, on the other hand, is a member organization, you know, and we represent over 60,000 OB-GYNs. But we're really geared at advocating for each other, advocating for our patients, and also developing the evidence-based guidelines that ABOG uses to be able to maintain the standards of care. Whereas ABOG is this board certifying specialty, I think they all work in tandem to be able to make sure that we are the best physicians we can be for our communities, whether that's through maintaining the standards of care, advocating for our patients, or ensuring that we're training the next generation of physicians up to those standards that we've set. I think they actually work together really closely, but they are distinct organizations, and I think serve very different purposes. And knowing what those purposes are, I think are imperative to being able to have those discussions with the junior fellows or the diplomates or the residents.
It's one of the things I think is really important is that when I look at the future for our field, it's important that those entities, as well as the subspecialty membership society, stay very strong, right? Yes. Because they are really producing the evidence, and that evidence is nationally, you know, focused. You know, we don't really regional. The care sometimes gets regionalized, but the holy grail or the North Star should be what is best practice, and that evidence drives that. So, it's something that we really need, for example, when we create and administer board exams, right? We're setting standards, and those standards are based in science, grounded in science, based on evidence, and they are national standards. They don't vary depending on where you live. So I want to shift gears and talk about that just a little bit. This is one of those thorny subjects that I think about a lot, and that is that at ABOG, we certify people with lots of different viewpoints, and we certify people that have different values, and we're respectful of all of those values as long as they're grounded basically in evidence based on solid science. This is the way that we like to think about things. And we often survey. One of the things that people don't realize, we spend a lot of our time surveying to understand what's going on in the practice today. This is a social media driven world, right? And so one of the things that is really important is how do we really elevate this idea that there is sort of a best practice and there is a standard of care, and people are entitled to have their own values and viewpoints and opinions, but there's a point where it's misinformation, and that can be problematic primarily because it's harmful to patients. Can you talk a little bit about what that looks like, probably from your perspective, as being in the early part of your career and still being in training? What does that look like to you, and how do you think social media influences that?
I feel very privileged to have been able to kind of see social media progress over the course of my training. So when I started med school, you just had Facebook and maybe Instagram, and then now, we are in the era of TikTok where a lot of people are getting their information. I think social media can be a really powerful tool for educating clinicians, for teaching students, teaching residents, as long as it's coming from someone who maintains the standards of care. Likewise, I think social media has been a really great advocacy tool as well. I think a lot of providers on there have encouraged patients to ask questions in the clinician room, have encouraged them to kind of take autonomy over their health care and over their care. But I think one of the things we've run into over and over again is that there's really no checks and balances on the information that's disseminated on social media, and some of it can be really harmful. I think trainees in the last 10 years have really struggled with this. I think, just a couple weeks ago, I was on call and had many sick patients that were here to get induced, and many of them declined Pitocin because of what they had heard on TikTok. And so it does raise an opportunity for us to be able to, I think it's an area of training. I think it's an area that our future physicians need to be ready to handle and talk to patients about the misinformation that's online. How to do that, I think, is an evolving discussion, but I find it really important that the voices we're elevating on social media are those that are board certified, that have maintained the standards of care. Because I think there's a happy medium where, we can elevate the voices that have gone through the rigors of being board certified, maintaining their practices, but also have this platform to elevate the voices of their patients and their colleagues. What we don't have established yet is what is that avenue to do that, or how do we ensure that the voices that are being elevated are the appropriate ones?
Yeah, it has the opportunity to be a really great tool.
Yeah.
So if you think about, one of the things I think about is a lot of times patients really aren't prepared for their visit because they don't know what to ask. So even if it was, some intentional information that allowed someone to be, you use the word autonomy, to bring more autonomy to their visit, to have some idea really based on good science and good practice about what's really important. I think there could be so much more that's gained out of that very precious time that you actually get to spend one-on-one with a patient. There are pitfalls. I think we're just in the process of an evolution, learning how to harness it for good, and then hopefully trying to minimize sort of the damage that can occur from misinformation.
And I think, ACOG, ABOG, ACGME are all kind of headed in that direction, right? We all have our social media platforms where we're trying to elevate the appropriate articles, the appropriate evidence, teach patients what to go to the encounter with and what to ask. But I think as far as being able to identify individual providers or even patient experiences online have the opportunity to really misguide and misinform a lot of our patients. And so how do we address that, or how do we create educational avenues for trainees and providers to be ready to address that, I think is a big area of opportunity and potential.
You know, one of the things that ABOG does through its continuing certification program, right? So it's not that you just take the test. I had this change on me during my 3 decades of practicing OB-GYN, right? You, not only do you pass the exam, but you're going to continue to demonstrate that you're staying current. And so maintaining certification and maintaining your board certification is important. And that sort of gets back to this aspect of mastery. Because what we know is that if you don't continue to learn and grow and you're not curious, you basically kind of fall down that curve and you become complacent, and you're probably not going to be the doctor that you were, or even your colleague that has stayed curious and continued to learn. And I think there may be some opportunity for us to harness social media, you know, in this continuing certification process to make it easier for our diplomates, unburden our diplomates. We all have a million things to do today. What do you think about that?
I think it's a wonderful idea, and I think part of what's happened in this generation is just we're kind of inundated with information from every avenue, whether it's the EMR, social media, our phones going off, the news. So our attention span is a lot shorter, right? We need to be able to meet the trainees and the providers where they are, and that might be something like a 30-second Instagram reel that highlights the latest MOC article or highlights the next best practice. And I think a lot of organizations are headed that way, but even patients, like, they don't have the time to sit and read through the guidelines we write. A lot of physicians don't have the time to sit and read through the guidelines that we write. And so things like this podcast, things like Instagram Reels, or being able to meet everybody where they are on social media, I think is a great opportunity to be able to not only like meet everyone where they are generationally, but also to be able to disseminate more information faster, right? We're like absorbing information at such rapid rates these days. Reading an article, while it's great and essential, like, it doesn't stick anymore the same way that it does when we hear it, see it, scroll through it, and can refer back to it.
Well, Alan, you know, the funny thing is old dogs can learn new tricks.
That's right.
My family thinks it's hysterical that I love reels as much as I love reels now. So Alan, one of the things that you said really has gotten me thinking. And it's something that I have been worried about, and that is sort of potential schisms and factions developing in the specialty. You know, we all have enormous pressures, political pressures, economic pressures. We have information overload that we talked about, and trying to sort out what's right and what's not right, or what's based in evidence and what's not. Can you tell me a little bit about your thoughts around this unification of the specialty and the way we ought to be thinking about ourselves, and what can we do?
Today we've talked a lot about things like community and connection, and I think we're at a really pivotal time in the specialty where that is so important. Every day it feels like we wake up and there's a new fight, whether it's labor and delivery units closing across America, our patients having to travel further and further to get the care they need, political influences in our practices, or information overload. There's far too much going on for us to not be unified. And I think to be able to survive the next decade and to be able to adapt to the next generation of trainees and meet the demands of our patients in the future, we really have to be kind of centered as a community on what our goals are. And that is to show up for our patients in the best way that we can, but also to show up for each other in the best way that we can. And I think hopefully today our viewers have learned that there's a lot of different institutions out there. These institutions exist to make sure that we are elevated and we are showing up for our patients and for each other every day the best way that we can, right? When you wake up and you have to kind of feel like you're going to fight every day, you want to be able to rely on these organizations to have your back, whether it's on Capitol Hill or whether it's in the clinical encounter or whether it's to stay board certified and maintain the standards of care, to have the tools you need to kind of combat, so to speak, all this unregulated guidance that's out there, and be able to kind of use all of that information in a cohesive way. I think it's really important for us to show up for each other and together.
I think that's such an important message. It seems so simplistic, but if you wake up every day and you think, how am I going to take the best care I possibly can of the patients that I'm serving, or in my role that I have now, I wake up every day and think about how do we create better and better, more rigorous processes, and also unburden the diplomate and the candidate as much as we possibly can. I wake up and go, how am I going to make impact today? And so I think if we thought, all of us really thought about that as our number one goal, and that is, how am I going to make impact for the patients I take care of today, it would put us all in good stead. And I think it also would help us manage the stress around all of these other issues that you bring up.
Yeah. I trust that as a board certified fellow, when I show up for my patients, I've met those standards of care, right? Obviously, we all struggle with clinical decision making, but I feel I have kind of passed that process of knowing that I can make the decision in the clinical encounter.
Board certification means that you're in an elite community of people that have demonstrated that they have the skill, ability, and professional attitudes to provide great care for their patients.
You don't have to worry, right? Like, I know I'm board certified, or by being board certified, I trust in the education I've received, right? I have that to fall back on. And so I think with all the things we've discussed today, burnout is higher than ever. And it's so imperative for each of these institutions to kind of tackle burnout in their own ways, right? While the MOCs might seem daunting, I can trust that by maintaining that certification, I'm ready for whatever's going to walk in the door, right? Yes, I practice a very niche part of OB-GYN, but I'm an OB-GYN first, and I have to be prepared for whatever happens. And so I think I'm grateful for the board certification because it allows me to maintain confidence in my skill set and in the training I've had. In the same way, I'm grateful for my work with ACOG because I trust that they're there for me as a member of this organization and as an advocate for my community and my patients.
Well, I think that's going to sort of wind up our time, but I wanted to give you one other opportunity, and that is if you could tell our viewers and listeners, because this podcast is video as well as audio, if you could tell them one thing and leave them with one thought, what would it be?
One of the things I'd like the audience to remember is that we're all a little piece in a big system, right? We're all part of this large coalition of OB-GYNs, and all these different entities that we've discussed today help make us whole, right? Every day seems like a new challenge, but I would want to remind everybody that each of those institutions we've discussed are here to support us and to make sure that we're showing up the best that we can for our patients.
So each one of these institutions really serves an essential role. ACOG is producing materials that we use to make sure that we're certifying based on the latest evidence that's grounded in science. And we couldn't do that without the materials that ACOG produces and the subspecialty societies as well. So I'm kind of using those terms interchangeably today. I think that one of the misconceptions that people have around ABOG is that we're trying to have people not pass our exams. The reality is we want people to do well. We have a responsibility to the public to make sure that we are assessing people rigorously, stringently, based on evidence, with a national perspective. And so that's what we will continue to do. But we really want you and your colleagues to do the best that you can and be board certified physicians and be proud to be able to tell your patients and your colleagues that you've gotten your board certification.
Well, I think it's more essential than ever now. I think, we've talked about what each organization does, and it's silly to think of board certification as a tool for advocacy, but we've talked about things like social media and lobbying and showing up for each other. And I think being able to have that stamp of approval, being able to present yourself as a board certified physician, I think allows your audience to hear you in a different way, right? It gives us a seat at the table. And so in some regards, from my perspective, being board certified in this era of misinformation or, unregulated guidance is a tool for advocacy and is a tool for us to show up for our patients and each other in the best way that we can.
I think that one of the things I'd like our audience, especially the fellows and the residents, to take away from this is really the importance of continuing certification. And that is that we are looking and exploring at really scientifically validated methods to ensure that we are helping you with the least burden possible stay as up to date and also make it relevant to your practice, right? You're going to be in a very niche practice, a critical care, maternal fetal medicine, hopefully board certified OB-GYN. And, you don't need to read soup to nuts. You just need to make sure that you're reaching mastery in that very unique focused area that you will end up practicing in. And so that's what we want to do for everyone. And so that individualization is something I want you to stay tuned for. So thank you so much for coming to Dallas and spending this time with me.
Well, thank you so much for having me today.
And to our audience, I would say thank you so much for joining us for this session of Talking Women's Health, and we'll see you next time.